Good evening, Soras of Alpha Kappa Alpha Sorority Incorporated. I never get tired of saying that phrase. I'd like to welcome you and our invited guests who have joined us this evening for Alpha Kappa Alpha's This is a Serious Matter, COVID-19 Issues and Answers Virtual Forum and Town Hall. It is with great honor and humility that I greet you on behalf of the leadership of Alpha Kappa Alpha Sorority Incorporated as your moderator for this evening. Alpha Kappa Alpha Sorority Incorporated is the nation's oldest Greek letter organization. We're 110 years old. Established by African American college women in 1908. We're an organization of nearly 300,000 members with over 1,000 chapters located all over the world. And tonight, we are proud to tell you that we had over 14,500 registrants for this important virtual forum and town hall event. You hear what I said? 14,500. The United Nations has called the coronavirus COVID-19 pandemic the defining global health crisis of our time and the greatest challenge that we have faced since World War II. Since its emergence in Asia late last year, the virus has spread to every continent except Antarctica. Cases are rising daily in Africa, the Americas, and in Europe. Countries are racing to slow the spread of the virus by testing and treating patients, carrying out contact tracing, limiting travel, quarantining citizens, and canceling large gatherings such as sporting events, concerts, boules, and schools across the board. The pandemic has been described as a wave, one that may yet crash on those least able to cope. But as African American women, we know that COVID-19 is much more than a health crisis. With the added stress of limited testing, institutional racism and sexism, healthcare inequities, fear, and uncertainty, it has the potential to create devastating social, economic, and political crises that will leave deep scars on the Black and Brown community for generations. So tonight, we're going to take a deep dive into the new normal that is COVID-19 from the perspective of the government, medicine and science, the media, the role of faith, and how we as sorors of Alpha Kappa Alpha Sorority Incorporated can continue to be of service to all mankind during this global pandemic. It is with great pleasure that I start this evening with that in mind. Alpha Kappa Alpha is privileged to be led by a woman who brings intellect, organization, style, and grace to the table. Our soror, Dr. Glenda Glover, PhD, JD, and CPA, is the president of Tennessee State University and Alpha Kappa Alpha Sorority Incorporated International President. She is the leader of the sorority, an organization of nearly, as I said, 300,000 members with over 1,000 chapters located all over the world. And she's a certified public accountant, a licensed attorney, and one of a handful of African-American women to hold a PhD, CPA, JD combination in the United States. Professionally, she's serving as the Tennessee State University, her beloved alma mater's institution's 8th and first woman president. So out of respect and deference, I like to refer to her as Madam Supreme. It's only fitting that she opened this evening with a welcome to all of our sorors who have joined us across the world and our guests who have joined. It's my pleasure to introduce you to Dr. Glenda Glover. Dr. Glover?
Thank you. Thank you, Star. Thank you very much, and to this distinguished panel and to all listeners everywhere. What a pleasure it is to greet you to this conversation tonight about another serious issue that once again is disproportionately impacting our community. Just like in the 1950s, when Alpha Kappa Alpha women from across the country came to Mississippi for the Mississippi Health Project, tonight, women around the world are tuning in for this historic COVID-19 town hall meeting. And we're going to keep our commitment, just like we did in the 1950s. We have that same commitment to human rights, healthcare rights, and health protection. And again, as your international president, I am delighted to underscore that this esteemed dynamic panel just happens to be all members of Alpha Kappa Alpha. And we are in. This meeting is so phenomenal that by the time you finish listening to this esteemed group, you will make the same declaration as the Queen of Sheba. when she had examined all of King Solomon's riches, and she said, the half has not been told. So tonight, we express how we had to put strategy in our struggle, authority in our actions, and power in our priorities. We address the results of disparities, neglect, and selective health care. We gather tonight because we recognize that it is sinfully unfair, it is disgracefully unreasonable, and it is morally unjust. We are called to a greater service, a chosen mission, and sanctioned for this purpose. So, as strong women, let us stand together, band together, stay together, pray together. This is our moment.
Dr. Glover, you sure know how to put the words together so that you set the tone for us this evening. Thank you so very much for your welcome and your comments. Ma'am, I'd like to start off with a question that comes from some of our sorority sisters, and this one specifically comes from the Southeastern region, which is your region. You are a president at an HBCU, and HBCUs are already facing financial challenges. Are you concerned that the financial impact of this virus may lead to the closure of some of the more financially challenged HBCUs?
Well, we're concerned that it may lead to the closure of not just HBCUs, but any institution. The CARES Act, and thank you so much, Senator Harris. The CARES Act helped, but it doesn't go all the way. The debt is high and it's still climbing. But we can't predict what's going to happen this fall. If the healthcare professionals can't make that prediction, we certainly can't. But yes, we are concerned, and we put pandemic task force in place, but nothing can be predicted. It's about what would happen. All we can do is prepare for it and have the preparations in place. We do suspect that there'll be some changes in our priorities. There'll be some smaller class sizes. There'll be some social distancing, the way to put it, coming back to school when it's predicted to happen again. Put things in place so we can be preventive and not necessarily reactive. Because remember now, the HBCUs were among the first, and colleges and universities in general were the first to have to shuffle and get students home and get prepared for this right away with no notice. And so we're prepared for the fall, but we're going to make sure that we put enough in place. The finances will look quite differently, but everybody's going to struggle through it and manage. There are a lot of us who are needing funds, but we're not about to close. HBCUs have always stood the stand of time. So and I think that there'll be some changes made. Funds will be needed, but we're good at raising money. Usually alumni and others come together and support our communities, support our schools. So we're depending on each other to make it through this crisis. And we believe that we will.
And thinking about just some of the traditions, I think of our sorority itself. Hugging when greeting and hand-holding when fellowshipping are a big part of our sisterhood. Do you envision a new normal in terms of future conferences for organizations such as Alpha Kappa Alpha?
Well, we have learned a lot from this pandemic. We know that we must proceed with caution. I believe there will come a time when we'll be able to embrace again, but we must wait until that time comes. We all want to live, so we want to embrace and show our love and fellowship with each other. But the first and foremost, we must be safe. So we see some distances and some things happen in the fall. We see how we set up our banquets and the large gatherings to impose the social distancing in that area, to say this is mark off 6 feet, or put tape over this chair, no one can sit here. So we see some things happening that will cause changes in the future of all of our gatherings. But we believe that it's short-lived. We just can't make the prediction as to when we can get back to normal as we know it.
Yes, indeed. Thank you, Dr. Glover, Madam Supreme. We are going to hear from you a bit later in the evening. And at this time, it's my pleasure to introduce our next presenter, the esteemed soror, the Honorable Kamala D. Harris, our United States Senator from the state of California. As you know, she is the United States Senator from California. She is on the Senate Committee on Budget, Homeland Security, and Governmental Affairs, Federal Spending Oversight, Emergency Management, the Judiciary, and the Senate Select Committee on Intelligence. We see her shine all the time. She began her career as a deputy district attorney, ultimately becoming the 27th district attorney of San Francisco, the 32nd attorney general of California. She's been the junior United States Senator for California since 2017. As a friend of over 30 years, a proud member of Alpha Kappa Alpha, initiated at our beloved Alpha chapter at Howard University. It's my pleasure to introduce you to the Honorable Senator Kamala D. Harris, who will address the government's response to COVID-19. Senator?
Thank you, Star. And Madam Supreme, I'm so honored to be with you this evening and our other sorority sisters who are going to be presenting this evening. You mentioned our history, our sorority's history. In 1935, it was Alpha Kappa Alpha Sorority Incorporated that instituted the first mobile health clinic to help folks in the Mississippi Delta. We have a long tradition, which is part of the spirit of our founding, which is of service and service to others. And this couldn't be more of a time where our service is so desperately needed. I also commend all of the members of our sorority for what's been done in creating the pandemic task force as a way to understand that we need, those of us who take care of others also need to take care of ourselves. And so the task force being designed to address mind, body, and spirit. So I just want to thank everyone for that. In terms of the government response, I must say that there's been a failure at the top levels of the United States government. And so what we have seen is a shift where local and state officials have really taken on a great amount of responsibility for addressing the fact that this at its core is a public health crisis and in need of a public health response led by public health officials such as Dr. Harris, who's going to present later. This is also, of course, been transitioned. This is also an economic crisis, and that has to be addressed immediately. So I'll talk about it in particular as it affects the African-American community in the United States. So what we know is that Black folks are 30% of the victims of death, in spite of the fact that we are only 13% of the population of the United States. What we know is that any crisis highlights the fact that there are disparities that existed before that become even greater and more apparent in the moment of crisis. Folks who were doing badly before do even worse during a crisis. So let's look at it in terms of the health issue. Pre-existing conditions. We are 20% more likely to have asthma, 40% more likely to have high blood pressure. Black women are 3 times more likely to have lupus than white women, which of course is an autoimmune disease. Sickle cell. One of the great vulnerabilities of those who have sickle cell anemia is any kind of respiratory virus. So what already were conditions that should have been addressed but have not because of systemic racism and implicit and racial bias now become highlighted during the course of a pandemic such as this, which at its core is about a highly transferable and a disease, a virus. We are seeing also that when you look at the issue of the fact that it is a respiratory illness, let's also remember all of the work that we've been doing together as a sorority to address the issue of environmental justice. Why do we bring that up? Because environmental justice is about reducing the pollution that causes our air to be polluted and causes 70% of the people who live in what are considered to be the worst air quality conditions in America, 70% are Black. Let's look at the fact that that we are 15% more likely to die from coronavirus if we have been exposed to dirty air, to air pollution, okay? So these are some of the things. We can look at the incarcerated population. I've been communicating with Attorney General Barr and the Department of Justice around what they are doing or not doing, and in this case, mostly not doing, to make sure that the incarcerated folks are in safe conditions, but also that we have early release for people who are aged, people who have health conditions, pregnant women. Let's look at the economic impact on the Black community because of this pandemic. Well, over 50% of people with a college education or higher can work from home. Only 4% of those with less than a high school diploma can work from home. When we look at it in terms of pay equity issues, those 30 million people who just in the last few weeks, several weeks, have lost their jobs with no preparation, no anticipation of this. Well, most do not have savings. In fact, before the pandemic, almost half of American families could not afford a $400 unexpected expense. Well, why are we talking about this in the issue of racial disparities? Well, let's talk about pay equity and the fact that Black women are paid 62 cents on the dollar as compared to white men. So she's got to pay the same amount for rent, she has to pay the same amount for food. But when you're talking about not having savings coupled with the salary that she earned not being equal to other people, we know that the equity issues become much more severe in the moment of this pandemic. Let's talk about education. So, and Dr. Daughtry, you and I have talked so much about your leadership nationally as an educator. 39, this was a study in 2019, 39% of college students are food insecure. That was in 2019, that study. Now, you know, it's even worse now. And at the same time, my alma mater, Howard University, did a study of its students, which is a good sample of HBU students, and over 70% were food insecure. Why am I bringing that up? Because a lot of our students, in particular at HBCUs, were qualified for SNAP benefits, that they used to call food stamps, right? Well, the problem is that they qualified also because they have work-study, right, programs. So they were actually working. Why is that important? Because SNAP benefits require that people are working. Well, the kids are no longer at college doing work-study. Plus, we have 30 million people who just lost their jobs. And so part of what I'm fighting for is to say we should eliminate the work requirement for people to get SNAP benefits. SNAP benefits are about feeding people who are hungry. So these are some of the ways that this issue is playing out. And we cannot emphasize enough that this also presents a moment of opportunity, which is to yet again make everyone understand and look in the mirror about the long-standing disparities that have existed in our country based on race, that have been highlighted by this pandemic, but also that need to be corrected. One of the things I announced today on Saying Closing is I have a bill that is creating what we've named the Racial Disparities Act. And basically what it is requiring the government to collect data about racial disparities through the course of this pandemic, and to not only collect that data, but let that data be the basis of how we're creating priorities around the distribution of resources, be it masks and gloves and PPE, and what we're doing in terms of supporting small businesses. I've also suggested, and we should know that so many of our small businesses, if it's the beauty shop, the barber shop, the florist, they're not banked. They don't have lines of credit with big banks. And they have been left out for the most part of all these bills that have been passed recently. So in the last bill, we got 60%, $60 billion that should go through the community banks, through the neighborhood banks to those small businesses. But what I'm also arguing for, and we should all advocate, is that in the next big bill, there is a tranche of that money for small businesses that is dedicated specifically to small businesses with 20 or fewer employees. And what we know in particular is that Black businesses, the majority of, are 10 or fewer employees. But we've got to make sure that at the end of this crisis, we have the ability to recover, which means giving people the ability to get through this. So at the end of it, they can get back up on their feet. Thank you. Thank you.
Thank you so much, Senator Harris. And as I hear you talking, we talked a little bit about the government's response, the impact, the disproportionate impact on Black and brown communities. And one thing that you didn't touch upon, and I'm going to ask you this question from the Mid-Atlantic region. If it's true that the coronavirus may actually return in the fall, which is what everyone is talking about, what impact do you believe that this will have on the presidential election? This is something that is causing a great deal of agita, as we say.
Yes.
Are you concerned that social distancing or other requirements may make voting more difficult, particularly for the African American community, because you and I both know they don't make it easy just on general principle?
That's right. Thank you, Star. So You know, the last big event I attended with so many of the folks who I think have joined this evening was to be in Alabama to walk across the Edmund Pettus Bridge commemorating Bloody Sunday and with John Lewis and a lot of the members of the Congressional Black Caucus, which was a day when people marched and blood was shed in the effort and the fight to gain the right to vote, right? And have access to the polls. So you can go that far back. You can go as far back as 2013. The United States Supreme Court gutted the Voting Rights Act. And thereafter, 24 states at least put in laws through their state legislatures, laws that in the case of North Carolina were found to have been crafted with surgical precision, which was what the court said, to deny Black folks the right to vote. That's 2013. Then you go to 2016. I serve on the Senate Intelligence Committee, where the intelligence community of the United States found that in the election of the President of the United States, and what's most important about those findings, and I encourage folks to read it, the findings are public, they targeted Black voters. They targeted Black voters with a misinformation campaign because they knew that Black voters would be vulnerable to any campaign that was so distrust in the system, because we have good reason to distrust the system, and it preyed on that. So you couple that, but now we're in the middle of a pandemic. And whereas we always, before the pandemic, had campaigns to remind people of why they should vote, now some folks are going to say, look, I've got a good reason not to vote, which is I'm not trying to get sick. You look at what happened in Wisconsin, where the legislature there were playing politics, forced that election to happen. And in Milwaukee, a predominantly Black city, whereas they usually had 100 and something election sites, they only had a handful. And so we know that there's going to be greater disincentive for folks to vote. I am proposing what I have named the Vote Safe Act, which would do a number of things. It's $5 billion to the states to encourage vote by mail. Now let's talk about that. Vote by mail. We have traditions of going to the polls on election day. We have traditions of taking our children of souls to the polls because we know people die. And so we go as in honoring the ancestors to the polls to vote. Well, we need to push for vote by mail. And I have to say to everybody, even if it is not part of the tradition that we celebrate around voting in person, we can honor the ancestors by voting by mail. The bill also encourages early voting so that states would allow people to vote for up to 20 days before the election. And then finally, what it does is say, let's make it safe for people who do go to vote. In particular, allow for curbside voting and require the states to put in place a time limit by which people should have to stand in line. So in Wisconsin, it was 2-3 hours. We're saying it should be a certain number of minutes, and then the state should create an election system around its polling places so nobody has to stand in line to vote for more than that number of minutes, the standard they create. But these are the things we have to do. This election in 2020 is going to be one of the most important in our lifetime. And we've got to make sure that people vote in a safe way and that they vote, because elections do matter, and who is sitting in those positions of power really makes a decision in terms of whether folks are going to get the benefit of all that is supposed to be the ideals of our country in terms of equality and fairness.
And Senator Harris, you so eloquently pointed out what our traditions are when it comes to voting, but we are also people who get involved in our local campaigns and in our national campaigns. So what are some of the this is a question from the far western region, which happens to be your home region. What are some of the concrete steps that we can take to assist political campaigns in this COVID-19 environment and still be safe?
Right. Well, there's so much. I mean, it started with President Obama when he started running in 2007, where the organizing online became such a powerful force that we saw firsthand. So there are many ways that obviously everyone who's participating right now has some access to technology. And that's about using your contact list, using your network, the people that you engage with in terms of social media, to talk with folks about what's at stake in this election and why they should be propelled to vote. It's about supporting our nonprofit organizations and making sure that they have all the resources to advocate for safe voting sites. It's about, again, always supporting our churches, which always have been part of making sure that people exercise their right to vote and figuring out creative ways to help people. So one of the things I'm concerned about is that there are a lot of states, over almost 2 dozen, that do not allow vote by mail. And that may not happen. They may not institute vote by mail by November's election. So we're going to have to advocate for safe voting sites. And again, that's about using the powerful voices of the members of Alpha Kappa Alpha Sorority Incorporated to advocate and demand safe voting.
Well, that's one thing that we have, and that is a collective voice. As the nation's oldest African-American sorority, traditionally African-American sorority for women, we know how to use that voice and to organize. I want to thank you so very much for your contributions, not just today, but every day on behalf of women and Americans and African-Americans all across our country. Thank you, Senator Harris. We very much appreciate your participation. We're just getting started, and so it is now my pleasure to introduce our next presenter. Dr. Patrice Harris, MD, is the 174th president of the American Medical Association. She is the first African-American woman to be elected president of the American Medical Association, having served on the AMA Board of Trustees since 2011, and as its chair from 2016 to 2017. She has long been a mentor, a role model, and an advocate. A distinguished fellow of the American Psychiatric Association, Dr. Harris continues in private practice and currently consults with both public and private organizations on health service delivery and emerging trends in practice and in health policy. She's an adjunct assistant professor in the Emory Department of Psychiatry and Behavioral Sciences, and an adjunct clinical assistant professor in psychiatry and behavioral sciences at Morehouse School of Medicine. It's my pleasure and honor to introduce Dr. Patrice Harris, who will address where we are and where we're going with COVID-19, medically and scientifically. Dr. Harris?
Well, thank you, Soar Star, and thank you, Madam Supreme. What an honor to be on this panel of sensational sorors. And Senator Harris, thank you for your support of physicians and other frontline health professionals as we battle this pandemic. And thank you so much for your bill regarding collecting racial and ethnic data. We cannot solve problems around health inequities until we have the data. So certainly appreciate that. Let me do a little bit of level setting and just remind us all that women play a central role in the delivery and support of health and wellness and healthcare in our country. Not only women who are on the front lines as doctors and nurses and other health professionals, but also in the home. We are the primary caregivers. We are the main point of contact and coordination for care for our entire family. Women make 80% of healthcare decisions in the United States. So it really makes sense that we are together tonight, because that means that we have a profound power for change. Just a little bit of level setting as far as where we are in COVID-19. COVID-19 is the disease that is caused by a novel coronavirus. Now, coronaviruses have been around for a while. They are a family of viruses, but this is a new one, and it is causing this new disease, COVID-19. As Senator Harris said, it's mainly a respiratory disease. It is easily transmissible. We believe that it is mostly transmitted through respiratory droplets when we cough and when we sneeze. And certainly you have to be in close contact. That's why we are urging everyone to stay at least 6 feet apart as we physical distance to prevent the slow of the spread. You know, the first confirmed case in the United States was reported around January the 20th. The first death, actually, originally we thought was February 29th, but it ended up being February the 6th. And the first known suspected local transmission occurred February 26th. So from that first case in January, we now have over 1 million cases in our community, in our country, and over 63,000 deaths. Certainly, we need to look at the issue around inequities. Just today in Atlanta or in Georgia, we learned that over 80% of the hospitalizations were African American. I'm sure you've seen the statistics in Milwaukee, where African Americans composed half of all the cases and 80% of the deaths, only representing 1/4 of the population there. In Chicago, 70% of COVID-related deaths were in the Black community, which is less than 1/3 of the city's total population. And so we are seeing these trends play out wherever race and ethnicity data are being collected. And again, that's why it's so important that Senator Harris, we're so grateful that she sponsored the bill, because we need standardized collection of that data so that we can really target interventions and treatments. Now, why are we seeing these disproportionate impacts in Black and Brown communities? 3 overarching reasons. The first is that we are disproportionately impacted and overrepresented when it comes to cases of diabetes and high blood pressure and obesity. We also are disproportionately members of the frontline health workers, those essential health workers. And of course, our essential health workers don't have the privilege of working from home. So therefore, they are more exposed and again are overrepresented in the cases of COVID-19. And finally, another issue, and I'm so glad our sorority is putting on this panel tonight, because one key issue is misinformation. I spent the first couple of weeks of this pandemic really not in my role as AMA president, but really as a family member and friend, dispelling the myth that African Americans could not become infected with COVID-19. So we really have to make an extra effort to make sure that accurate information is available to our community. The good news is, though, we are flattening the curve overall. There are still some hot spots, and we can't take our eyes off the ball there. So what is working? Physical distancing, staying 6 feet apart, no large gatherings, wearing face coverings in public. That is working. I do want to say one thing, though, because again, as a physician and we are looking at the data, we all have to remember, and I know we know this in the sorority, that behind all of those data points are people. Those are people who are dying and they are leaving behind loved ones. So I think we should all remind ourselves that, again, behind all of the science and the data and the evidence, which is critical, those are souls. And we also want to make sure that we make that point and not totally look at this from a statistical and data point of view. What should we be doing going forward? First of all, we have to base all decisions on the science and the evidence. This is science and health above politics. We should be very cautious in relaxing our stay-at-home orders. We should continue 6 feet apart, wearing the face coverings. We absolutely have to enhance our ability to test. We are woefully behind on testing, and we have to increase and make sure that we have a robust testing infrastructure. And testing is just the first part. We have to track, we have to trace. And another point that I don't think we're talking enough about is we have to have supported isolation. Many African Americans, Black and Brown people live in houses where there are many generations. And if one becomes positive and needs to isolate, where will they be able to go? So that is also a part of the public health infrastructure that we have to make sure is supported. I'll end up with just a couple of points. Currently, there is no treatment, there is no vaccine, and there is no cure. We have scientists and researchers working on these. We don't know when we will be able to get a treatment. You've probably heard news in the last couple of days about a promising treatment, but until we have those randomized controlled trials that you hear us talking about, we do not have a treatment or a vaccine that we can recommend. There will be a future, a new normal. We will get on the other side of this pandemic. And when we do, I know that we can count on our sorority to continue to be a part of the conversation as we figure out what the new normal is for our sorority, for our country, and for the world. So thank you, Star, and I'll be happy to take questions now and later as well.
Thank you so much, Dr. Harris. You talked about flattening of the curve, the things that are working. We also touched on the jaw-dropping disparities seen within the African-American community. But I'm actually going to ask you to utilize some of your specific expertise as a medical professional and talk to us a little bit about strategies for managing the fallout of the pandemic on our mental health. There are a number of people who are dealing with fears and frustrations and stress and isolation and issues surrounding sheltering in place or being on lockdown, and change relationships in their families, their family dynamics, job losses and school closures, and literally the financial strain the pandemic has posed. This is your field of expertise. How do we manage our mental health throughout this process?
So as you note, I am a psychiatrist, so I'm particularly interested in this issue. And I will tell you that this is a crisis on top of a pre-existing crisis as well, along with the health inequities. We have had a woefully underfunded mental health infrastructure in this country for decades. And so here we are. So at baseline, listen, this is a great period of uncertainty, and it is normal to be afraid. It is normal to worry. And so I tell everyone to allow yourself to experience those fears. Don't beat yourself up for being worried or afraid or anxious. But I encourage us all to turn those feelings into action. We definitely need to make sure we are taking great self-care. We have to make sure we get enough sleep. Eat appropriately, although I think, we can all cut ourselves a break for that. I can tell you that I'm snacking a little bit more than normal, but we should try to watch what we eat. We should try to get some exercise. And again, that doesn't mean, and of course we can't go to a gym, but that may mean walking around your neighborhood. Now, I am aware that for some neighborhoods, there are no sidewalks or there are no well-lit areas to walk. And so we certainly have to take that into consideration. But if all else fails, put on your favorite, song. Mine is Frankie Beverly, Joy and Pain, and just dance, just get some exercise. However, if you do find that you don't feel like you're coping and you need help, I want everyone in our community to know that it is absolutely okay to ask for help. I know as Black women, we have this reputation, and it is a well-deserved reputation that we are strong. But being strong does not mean that we cannot ask for help. I would contact your local mental health center. I'm very excited. Many may know that Taraji P. Henson has a text line that is culturally competent and has culturally competent therapists available. So I just encourage everyone to ask for help if they feel like they are losing their ability to cope.
Thank you, Dr. Harris. I'd like to ask you a question that actually comes from some of our sorors in the central region. They are curious, what actually caused the coronavirus to move so quickly and so aggressively in the Black and Brown community?
I think we won't know that for sure until after we get through the acute phase and we can go back and look at the data. But here are some things that I might propose, and these will need to be tested. Certainly, it's easily transmitted to everyone. So I want to make this clear. Black and Brown people are not more susceptible to transmission of the disease. But what is happening is, since we are overrepresented regarding high blood pressure and diabetes, the worst outcomes, the hospitalizations, the ICU stays, and tragically death are happening in Black and Brown communities. So I believe it's because of the pre-existing health inequities. I believe it's also misinformation. We'll have to see what impact that had. But I also believe it's because Black and Brown people are overrepresented in those essential workers, the bus drivers, the folks who are cleaning our hospitals and other facilities, and therefore at risk for greater exposure. So I think those are a couple of reasons that we have had this overrepresentation of serious illness. And again, we'll test these hypotheses after we get through this acute phase. I do say we should not blame. Let me just say this. I want to make this clear that we should not blame anyone. Certainly choices are critical in all of healthcare, but I always say the choices we make are based on the choices we have. And so I really do not want anyone to blame, and no one should blame anyone in any particular community for being overrepresented in the more serious consequences of COVID-19.
Thank you, Dr. Harris. It's very clear there have been healthcare inequities in the Black and Brown communities for many, many decades. And this global pandemic has simply shined a spotlight on those inequities. And we are dealing with the ramifications of that, even as we speak right now.
Could I make one more point I wanted to make sure I made? Is also lack of access to healthcare. And we know having meaningful, affordable insurance is a way to increase opportunities for access to healthcare. And so that also is playing a role in the overrepresentation of Black and Brown communities, again, in the worst outcomes of the disease.
And I really want to thank you so much for not only your contribution just now, but graciously agreeing to join me for an exclusive Q&A session during the town hall portion, just some rapid fire questions that the sorors, the myriad of issues that have been raised by some of the over 500 questions we received from sorors over the course of the last few days. So I'm encouraging everyone in our audience to stick around for this important portion of the evening. You certainly don't want to miss that. Thank you, Dr. Harris. We'll be talking in a little bit. It is now my pleasure to introduce our next presenter, our soror Yamiche Alcindor. And my big smile on my face is because this award-winning journalist and PBS NewsHour White House correspondent makes us proud every single day. She is on that television and doing her job. And a political contributor to NBC News and MSNBC. Previously, she was a national reporter for USA Today and the New York Times, focused on politics, social issues, and policies that affect working class people and people of color. Her amazing professionalism, factual acumen, tremendous grace, and enviable poker face in the White House briefing room has caused sorors to cheer in our own homes every time he is on the screen, going toe-to-toe with the President of the United States by holding him accountable to the American people. Soror Yamiche Alcindor will address the media's coverage of COVID-19, the perception versus the reality. Soror Yamiche.
Hi, well, thank you so much for having me tonight. I feel so honored to be here addressing you, soror. So honored to be here with the national president, with Dr. Harris, Senator Harris, with you, Star Jones, with Leah, all of you. I'm just so excited to be here. So that's my portion for the deference. The thing that I'll say is I chose my first love, which was journalism. And as a result, to me, I feel so honored and blessed to be covering COVID-19 and this coronavirus crisis because I think you need to have journalists that really are dedicated to holding leaders accountable, but who are also doing their job with empathy and compassion. So some of the really interesting things that I have noticed from the very beginning of this outbreak is that there was a real difference between how Republicans and Democrats viewed the coronavirus outbreak. And what we've seen in our society is a polarization that's really deepened over the last few years. But now, as we're facing this global pandemic, we're seeing kind of the roots of how that actually plays out in society when we're in crisis. So at the very beginning of this, when the president in January and February, when he was in early March, when he was talking about this virus in a way that was not as serious, in a way that was kind of downplaying the virus, saying that a miracle would somehow sweep it away. Republicans were more likely not to take this virus as seriously, and you had Democrats who were the ones, according to polls, who were taking the virus more seriously. As the president's rhetoric has changed, we've seen Republican opinions change. So now what we're seeing in polls is that Republicans and Democrats kind of equally see seriousness in a similar way. What we also see now is that Republicans and Democrats still speak about the coronavirus in different ways. So if you're a Republican, you're really talking about now opening back up and the risk to the economy. If you're a Democrat, you're still talking about the risk and danger to people's lives. And what we see here is that, of course, there's a polarization in how you get your media. If you're someone who watches Fox News, you're also someone who likely is a Republican. If you're someone who watches the other networks like MSNBC, you might be on the more progressive side and might be more of a Democrat. So what we're seeing there is the fact that even the way that you see this in your everyday life it all comes down to media coverage. In my mind, I think the thing that we need to be doing right now is just be trying to get through to the truth and the facts of what this virus means. I think that means saying out loud over and over again that Black and brown people are some of the people that are being disproportionately affected. I think it's very clear that we need to say that Black people in particular are being affected by this. Of course, communities of color on the whole are being affected at disproportionate rates. But I think that there's a tendency with language to kind of group people in different categories when in fact, African Americans, because of segregation, because of systemic racism, because of our access to healthy food, because of all the stresses that everyday racism deals our lives, that there are a lot of people in this country that are in conditions that make them, of course, more likely to have diabetes or high blood pressure. And as a result, you see disproportionate rates in cities like Chicago and New York where African Americans are disproportionately impacted. I think the other thing I'll say is, and when it comes to covering the presidency, I'm someone who I think, as maybe most people see now, I'm unafraid to challenge the president and to call out when he's doing misleading things and to also say, hey, the president's doing something that is right today. He actually was talking about the facts, but also I need to point out when he's not talking about the facts and fact checking him in real time. And I think that that's what I've been trying to do during this crisis is really explaining to people, here's the information that you need to know. Here are what your leaders are telling you. Here's how they're misleading you. And also here's how they're telling you the right information.
Thank you. Sorry, Yamiche. I really do appreciate you being just so blunt and so honest. One of the questions that keeps coming up all the time is how the public should determine who and what to trust regarding media coverage. And you so eloquently pointed out, really, it really differs by people's main news source and their ideological makeup. But what should we be looking for to be discerning about what news items we can trust?
You should be looking for at outlets that you see as trustworthy. And I think you should also be looking at outlets that are not just American outlets, but that are international outlets. As someone who's Haitian American, I grew up in a household where my mother watches a lot of the news from France. She watches BBC. She also, of course, watches PBS and NBC. So I think one of the things to do is to really diversify how you get your news. And that means not just reading the New York Times and the Washington Post, but also maybe reading the Telegraph, the Guardian, other papers from different countries. Because I always say that as much as American journalists differ by how we cover things, the one thing that I think a lot of American journalists have is that we kind of believe that we live in the best country in the world. And as a result, some of our coverage reflects that. So I talk to my mom all the time, especially as someone who was warning me pretty early on. I would say in January, my mama started calling me up saying, hey, this virus is really serious in China. She was getting a lot of those really in-depth reporting from international sources. So I think when you think about where you're getting your news from, I think the number one thing you need to be looking at is kind of who are the trusted sources that I think when I look at them, they're telling the news, but also where are these people coming from? How are they funded? And I'll say Fox News, they have a White House correspondent named John Roberts. He asks a lot of tough questions. He's someone who pushes back on the president. So I think it's when you get into the television host late at night, with the Sean Hannitys, the Tucker Carlsons, that's where things can get a little bit more misleading. But I think it's easy to kind of to paint a network with one broad stroke. I think what you really need to do is be looking at how reporters are presenting the news and also how they're interacting with the president. We've seen some presidents ask, or seen some reporters ask the president tough things and be berated from Fox News, but also from CNN, of course.
And as you're talking about how to determine what media we can trust, we also need to look specifically at how the media covers the Black and brown communities. We all know that this disease is affecting us disproportionately, but the media doesn't always accurately reflect that and the devastating effect that it is indeed having on our community. I want to ask you a question from our North Atlantic region. The sorors want to know, quote, how do you remain so composed when the president reacts to you so negatively?
Well, I'll say sorors. I'm so excited to be part of Alpha Kappa Alpha Sorority Incorporated because I was taught and really became a woman through this organization. So when I was thinking about how to answer that question and thinking about the way that people ask me, how can you kind of do your job and stay laser focused? It's because, one, I belong to a sorority where women do that every day. They do that in their work. They do that in their personal life. It's about being strong. It's about understanding what your purpose is, about what your mission is. I had the mission of Alpha Kappa Alpha Sorority Incorporated very much memorized in my mind by the time I graduated college. So I think a lot of it has to do with the foundation of being in a part of a sorority where I saw strong women doing their work under circumstances at times that were challenging. I think also the thing is, I think of myself as a journalist, but I also think of myself as a civil rights journalist. No matter what beat I'm covering, if I'm covering the White House or education, I think civil rights is still at the heart of why I became a journalist. And so when I think about being focused on my mission, it's about being focused on vulnerable populations, giving people voice that don't have the voice, making sure I'm asking questions for people who might never get to the White House. And I think that when you think about it that way, when I think about the fact that my job is in the Constitution, I almost don't have a choice but to remain focused and to think about the responsibility that I have as a White House correspondent.
It's so beautiful to hear you take us all back to one of the reasons why we became members of Alpha Kappa Alpha Sorority Incorporated. By merit and culture, we strive and we do things that are worthwhile. So you are doing a fantastic job. I have one more question for you from our international region. And the sorors want to know, if given the opportunity for a one-on-one interview with the president, what would be your first COVID-19 related question?
If given the opportunity to interview President Trump one-on-one, the first question that I would ask him is, I would say in January and February, even into early March, you were downplaying the coronavirus and not taking it as seriously as other people around the world. What impact do you think that had on Americans? Or do you think that there are people who got sick because of your actions? And do you think we're now undercounting the number of people who have died and who have this virus based on the fact that you were not taking it as seriously in January, February, and into early March? Because I think as a journalist, one of the things that I think about as I think about how we're going to cover this in the months to come, I think about the fact that there are going to be people who may possibly died of this virus who were not counted because we were not thinking about where the virus on that.
I just want to tell you how proud you make us all the time, Yamiche, and we are honored that you are a part of this organization. And we say bravo to you all the time. Thank you again for joining us this evening, and I can't wait for you to be able to ask that question of the President of the United States. Thank you again.
Thanks so much.
It is my distinct pleasure to now introduce you to our final presenter, the Honorable Bishop Leah D. Daughtry, our national recognized organizer, activist, political strategist, author, and faith leader. Bishop Daughtry is the presiding prelate of the House of the Lord Churches. He previously served as CEO of the 2008 and 2016 Democratic National Conventions, responsible for all aspects of planning and execution of the Democratic Party's perennial presidential nominating convention. She is also the former chief of staff of the Democratic National Committee. She is a co-author of the best-selling NAACP Image Award-winning book, For Colored Girls Who Have Considered Politics. An electrifying speaker full of power and charisma, she transforms corporate teams, congregations, and communities for the better. And I am obsessed with her Wednesday words of wisdom. We are relying on Bishop Daughtry to help us keep COVID-19 in perspective through faith and fortitude. Bishop Daughtry, help us out.
Good evening, Star.
So you know I'm going to put a question to you that is going to require you to help me through this. Because as I look at everything that's going on around us in the Black and the brown community with women, the plague is overwhelmingly punishing for so many Black women. who have suddenly gone from being invisible workers to essential workers, while being disproportionately responsible for their children's 10 a.m. Zoom PE class, the noon geometry class, trying to find red curry paste at the store for the chicken curry you have to cook tonight, ordering all the PPEs you can find on Amazon, planning game night in with the SORs from your chapter. How are we supposed to stay sane and grounded during this extremely stressful time?
Yes. Well, first, let me start by saying, in church, we say giving honor to God, and to my international president, Dr. Glenda Glover, and of course to all of my sorors who are on this call. I'm so honored to be here, and I would be remiss if I didn't give a shout out to the sophisticated Southeast region and my own chapter, Psi Zeta Omega. I'm so thrilled to be a new soror. I waited a long time, and I'm thrilled to be part of the sisterhood. Star, you have phrased this exactly right. We are doing so much as women right now. And whether we are frontline essential workers or whether we have the privilege really of working at home, we are wearing multiple hats, doing multiple things, and it's hard to keep all of these balls in the air. There are a couple of things I would suggest to you, my Soras, as you are plodding through these days and these weeks ahead. A couple of weeks ago, I was so upset and I had gotten myself into a bit of a snit because my normal life had been disrupted. And I was just, nothing was as it was, and normal wasn't normal, and I was just upset. But then it came to me something that I want to share with you. I decided that I would change my thinking and I would begin to bless the disruption. And I tell you why I say that. This disruption that we are experiencing now has allowed us to reset our thinking. It has allowed us to really see the inequities in our healthcare system, the inequities of racism in our socioeconomic system that is allowing disproportionate numbers of African Americans to be affected by this disease. And it has allowed us to really disrupt our thinking about the lack of preparation of the government that we pay to be able to protect and heal our own people. This is a problem that we have lived with for decades. These healthcare inequities are not new. These socioeconomic factors are not new, but now everyone in the nation can see the disparities. Our previous thinking has been disrupted, and we have an opportunity to reset, to refocus, to now put in place the government that we need for our people to be treated fairly, for the healthcare inequities to be addressed, for the socioeconomic problems to be fixed. This is a disruption. If that's what comes out of it, then it's a good thing. But on a personal level, it has also allowed us to disrupt our own sense of apathy. As Dr. Glover said when she opened, we've got to change. We've got to put the strategy into our struggle. And now we have an opportunity. We're called now to come out of complacency, to come out of complicitness because of the apathy. Some of us didn't vote. Now, I know all the Soras on Alpha Kappa Alpha voted, but we all know somebody who didn't vote. This is our chance to disrupt the pattern of thinking and allow us to put some things into motion so that we don't wind back up here when this pandemic has moved on. It has also allowed us on a spiritual level to disrupt the patterns that we had of rushing to prayer time, rushing to church, of ignoring relationships, and allowed us to really come to value the relationships that we have, value the people that are in our lives, to reach out to them, to say we love you, to check on folks in a way that we intended to before. And sometimes we did, but now when we're not able to see our loved ones, when we're not able to go to their homes, it somehow makes our hearts beat a little faster, make us more intentional about how we reach out. And lastly, it has disrupted our spiritual space. But that's a good thing because now we have the opportunity to create, to craft, and to cultivate our relationship with the Most High God. He's gotten us by ourselves. And so now we can step back, take a moment, spend some time in prayer and meditation, talk to God, listen to God, and reset our relationship with God so that God can speak to us and put us in the place that we are able to move forward. So cultivate those relationships with your loved ones and with your God, and make sure that you are staying connected to the source, to the lover of our souls, the one who gave us breath and life. And let's hear what God has to say to us in this moment.
Sorry, Leah, I'm trying really hard not to just start clapping, because when you break it down like that, I feel strength, additional strength, and I so appreciate, and I know the Saras appreciate your words. As I listen to your words of faith and fortitude, I still have to go back to you putting your hat on as a community organizer, as a strategic planner, as we're trying to navigate all of this. And so I have some questions that will bring all of your experience to bear. And the first one actually comes from our Sora Sheila Jackson Lee, our Sora Congresswoman from Houston, Texas, who has really been spearheading the movement to make sure our community has access to testing and erasing the stigma some have placed on testing. As a community activist, a political strategist, do you believe that the Black community can do more to advocate for more testing, given the impact of the virus on our community?
Absolutely. There is always more that we can do by taking our own lives into our hands and taking responsibility for our lives. Call your elected officials. You have time, phone bank them. Remember that they work for you. Make yourself a nuisance and make sure they understand how the virus is impacting your community. I'm from Brooklyn, New York. And while the virus statistics are starting to go down in New York, the folks in the housing projects, the low income housing developments, are just now getting masks and sanitizer and equipment. And that's because community organizers kept calling the governor's office saying, you're taking care of some neighborhoods, you're not taking care of other neighborhoods, and you've got to do something about these neighborhoods that are being disproportionately impacted. Because remember, if you don't take care of those neighborhoods, that's where the bus drivers live. That's where the grocery store clerks live. That's where the nurses live. That's where frontline workers live. And if they get sick and aren't able to go to work, then the city really will shut down. We do have the power to change things because we are being so disproportionately impacted. Make yourself a nuisance. Call your electeds, call your city council. They're at home too. They are sitting socially distancing like the rest of us are. So make yourself a nuisance, make your opinion known. And when I used to work for a member of Congress, the people who called got a lot of attention because the people who called were the ones who would keep calling. And you needed to answer them and answer them well so that they were satisfied, because those are also generally the people who vote.
Sorry, Leah, I tell you, you took my request for faith and fortitude very seriously, and you have brought it all to bear. As I referenced when I first introduced you, I've become sort of relying on your Wednesday words of wisdom. And so as we close out just this presenter portion of our program this evening, I'd like for you to share some of those words of wisdom with our audience before we move to the town hall, if you don't mind.
Sure. What has been the center of my focus this week has been the way that God is leading us through this storm. And I was in Katrina. I went to New Orleans right after Katrina, and I noticed that some of the houses collapsed, some of the houses disappeared, and some of the houses were still standing. And I said to the woman who was taking me around, I said, "Why is this house still standing?" And she said, "It was the way it was built. That house was built for the storm." God has created each one of us with the ability, the gifts, the skills, the talents, the strength to stand and withstand any storm that comes our way. So as you're walking through these days ahead, these weeks ahead, and the challenges are coming to you, remember that God stands on the edge of the universe, knowing the life that He designed for you to have. And He knows what He created you to be and to do. And God didn't set you up and create your life just for the sunny days. He didn't create you just for joy and laughter. That would have been too easy and too short-sighted. But God made you to withstand the storm. God made you to be able to stand up when these kind of challenges come your way. Whether it is the challenges of your job, your family, your home, your relationships, or this pandemic, God made you for the storm. So as you deal with difficulty, as you have challenges, just say to yourself, I was made for the storm. I was made for this storm. I'm a prepared, fearfully and wonderfully made, equipped with every good gift, and I'm ready to walk into whatever God has for me, because God didn't create me to fall over. God didn't create me to wilt. We're Alpha Kappa Alpha women. We have strength in our bones. It's part of who we are. God made you for the storm. So just say that to yourself when you're feeling a little down, when you're feeling a little distressed. I was made for the storm.
Amen. I can hear all of your fellow presenters just praising God and listening to your words of wisdom. I told y'all on Wednesdays at noon on Eastern, you need to be there to hear our Soror Bishop just really break it down and serve up food for the spirit. Thank you again, Bishop Daughtry, Soror Leah. It is just an amazing opportunity to work with all of you today. I want to thank all of our power panelists, presenters for lending their time and their expertise to this important topic. We're going to continue. I don't want people to think that we're done, because Soror Dr. Harris is going to continue with the town hall portion and answer some questions. But I would not want to close this program out with saying how much we appreciate you all bringing your expertise and your brilliance and showing the world what Alpha Kappa Alpha women really are. So thank you, and thank you. Again, I can't wait to do this again with you on many other topics. And everyone, it is now time to drill down on some of the medical and scientific questions that our nation is so desperate to know the answers to. And there's no one better to help us with this than our own super doc, as I call her, Dr. Patricia Harris, president of the American Medical Association. And so, Dr. Harris, I'm going to jump right in. The United Nations says that humanity needs leadership and solidarity to defeat the coronavirus. Yet, according to all accounts, we're a long way from claiming that victory. We're now hearing that the coronavirus will return in the fall, and it may be worse. What can we do now to prepare ourselves for this, Dr. Harris?
I think that's the best question, is preparing. Emergency preparedness is a basic tenet of public health. And when we prepare, we won't overwhelm our medical systems. We won't have to make horrible decisions about who has access to a ventilator. So the best things we can do right now, of course, followed by science and the evidence, is to continue to slowly, methodically loosen restrictions. But even as states are deciding whether or not they want to loosen restrictions, we should all continue, again, basic public health tenets, staying apart, 6 feet apart at least, wearing masks, and doing very scrupulous hand hygiene. After you go to the grocery store or go pick up your medications, come home and wash your hands, and be very careful about touching your nose and mouth. You know, it seems almost too simple, but those are tried and true evidence-based practices that will hold us in good stead until we get a treatment and until we get a vaccine.
That was from the South Atlantic region. I want to make sure I give them credit for that question. And thank you, Dr. Harris. The next question comes from our international region. Do you envision a need to once again close down the country to travelers?
You know, it's difficult to predict, and that will be based on our loosening restrictions and whether or not we have a significant increase in cases. Now, I do want to say a couple of things, because I think folks should be prepared. Because we have not tested, we certainly have not seen the number of cases. We know that you can spread this disease when you have no symptoms, if you're asymptomatic, or a couple of days before you get symptoms. So we should all expect an increase in the number of positives. So we should be looking at the infection rate, who's sick, who's ill, who develops symptoms, who has to go to the hospital. And unfortunately, we'll have to look at the death rates. We know that in the fall, we have our usual flu season. I encourage everyone to get their flu vaccine because, again, we don't know how this coronavirus will act. Typically, viruses can decrease in the summer, but we don't know yet. But even the viruses that we know about, they do come back in the fall. So I think it's just critical to always look to credible sources of information. Your local public health department will continue to develop the data. It's hard to know if we will see a precipitous increase in cases. I believe if we go slowly, we are less likely to do that. But again, we will take 2 steps forward, collect the data, and then make the next move. And we may have to take a half a step back. Everyone should expect that. But I believe if we always keep a focus on science and public health, we can make continued progress. It may be slower than we'd like, but we can make progress.
Thank you again. This question comes from the Mid-Atlantic region. Why is antibody testing important? Do you know yet if a person who has had the virus are now immune to getting it again?
So let me just say quickly, right now, there are 2 sort of broad categories of testing. There's the one type of testing that tells you whether or not you have the disease. At that moment, you are tested. And that's sort of the diagnostic category. And another category are these antibody tests. You have to get blood to get those antibody tests. Antibodies occur after you've become infected. Typically between 1 and 3 weeks, these antibodies would show up. So the antibodies can tell us if we have already had the infection. Now, right now, we are in the early phase of antibody testing. We will need to continue to be vigilant to make sure those tests are reliable and accurate. But once we develop an antibody test that's reliable and accurate, that will tell us one thing. It will tell us if we have antibodies. At the AMA, we've been very careful to caution folks against interpreting these antibody tests as meaning, okay, I'm free and clear, I'm safe. And let me tell you, that's new information. A month ago, wondering and hoping that this virus would act like other viruses, I remember saying, I thus far haven't had a symptomatic test, but if I get a test, an antibody test, I'll be glad if I'm positive because that may mean I'm immune. Unfortunately, we just don't know that. We're seeing some data, international data, that shows people become positive after they develop antibodies. So we are still in the early phases of antibody testing. And so I want folks we do need to do antibody testing, but really the results, you should talk to your physician about those results because they will need to be interpreted in the manner of what's happening in your community.
Thank you, Dr. Harris. Again, this question is from the Great Lakes region. Since you are giving us the straight Skippy, as we like to say, what is the realistic timetable for 1, a vaccine, 2, a cure, and 3, achieving testing for all Americans? They're not letting anybody shy away. They want to know the real deal.
They are not. And believe me, if I knew, I would let you know. So let me just tell you. And again, Dr. Anthony Fauci is, a national treasure. Others have said that, a very solid scientist and really focuses on the science and the evidence. So he originally said around 12 to 18 months is a typical timeline. But you know what? We have an all hands on deck effort. And so I heard today we may have the development of a vaccine by January. So I think we should all be patient. And I will say this, though, as everyone knows, we still do not have a vaccine for HIV. And so, we hope that a general timeline is 12 to 18 months. We may, again, since we have an all hands on deck, a Manhattan type project effort, we may get something sooner, but we're going to have to be cautious about a timeline for a vaccine. I would say we are more likely to have a treatment approved before a vaccine. There was positive news. Again, it's still early. We can't make any predictions about remdesivir, but in the last couple of days, we've had positive result. Remdesivir is a medication, and basically it prevents the coronavirus from replicating in your body, which is a good thing. And so we're likely to have a treatment perhaps before a vaccine. But again, people are working on this all across the globe. And so we'll just have to be a little patient.
Okay, so now I'm going to give you a couple of rapid fire questions that are just some practical things that people have asked. This one's from the North Atlantic region. Can the coronavirus be spread through the ventilation systems in things like hotels and restaurants?
I think we're still learning about that. There was a recent study in China that said possibly that is being tested right now as we speak. But right now it's primarily close contact. But again, that we had that study in China, so we'll have to wait and see.
And this comes from the southeastern region, but it might as well come from me since I am a big fan of this. Does spraying Lysol or other antibacterial sprays in your home destroy the virus? If so, for how long?
Yes, we do know that bleach and some of these household disinfectants work on surfaces, right? Doorknobs and,
surfaces.
So yes, if you are, when you come home and you should regularly just disinfect those high touch areas in your home with Lysol and bleach solutions and all those cleaners. And certainly use, when you wash your hands, don't forget to use warm to hot water, use soap and rub for 20 seconds. And certainly if you are out and about and you don't have immediate access to a sink and water and soap, you can use your hand sanitizer. It has to have 70% alcohol content.
Mm-hmm. All right, another rapid fire from the South Central region. Is there a diet regimen or vitamin supplement that will ease or lessen the symptoms of this virus?
There is no evidence that a particular diet or a particular food or a particular vitamin can work with this virus.
And from our central region, is there any truth to the belief that warmer weather will help in, quote, defeating the virus?
As I said, coronaviruses have been around. These are the family of viruses. A couple of them cause the common cold. And typically, although, we have to say it's complicated because one of the reasons, we have decreased colds is in the summer, we're out more, right? And so we're not all closed in as we are in the winter. But we have seen other viruses decrease some in the summer, but we just don't know if this new coronavirus will act in the same manner. We'll have to wait and see.
And I have one last question, this one from the far western region. How are physicians preparing to render service post-COVID-19? And this is of particular interest to me because, as you know, I'm in the vulnerable population as a heart disease survivor.
Yes, this is a critical question because physicians and patients deferred some care at the very beginning. Now, the good news is, and if the audience did not know this, you can see your physician even over the telephone or using telemedicine. So that was a good thing. We appreciate the federal government for loosening some of those restrictions to allow that to occur. I do know, though, that many of my colleagues are really worried about the survival of independent practice, particularly those practices that are smaller, those practices that are in rural areas. And that is a worry. Again, the money provided by Congress and the administration will help, but we're still very worried. I do want to say no one should delay talking to their doctor about care. If you have diabetes, if you have heart disease, still take care of those issues. Again, you can use telepsychiatry. You can call your doctor. They may say, come on in, this can't wait. And so again, doctors and patients did defer some elective surgeries, some procedures. Those will be loosened as we loosen restrictions. But if you have any concerns, call your doctor. If you don't have a doctor, a usual source of care, call the local community health clinic.
Dr. Harris, I cannot tell you enough how brilliant you are. And You are the epitome of we strive and we do things that are worthwhile. You are an Alpha Kappa Alpha woman through and through, and we are proud, more proud than ever, to not only have you as a part of our sisterhood, but have you out there on the front lines representing us and making sure that, one, our interests are taken care of, but that you are protecting the health care of our entire nation, you and your team there at the American Medical Association. So thank you so very much. Our town hall, I just don't even know what else I could say. Thank you, Dr. Harris, very much.
Thank you.
Our town hall is just about over, and I hope you all enjoyed this virtual event, which brings me to the opportunity to, again, go to our illustrious international president, our Madam Supreme Basilisk, Dr. Glenda Glover, who I'd love to help us close this out. Dr. Glover?
Thank you. This has been a wonderful evening. I want to thank the panelists, thank the guests. I thank each of you for joining in with us. This has been so informative, educational, inspiring, spiritual, and just downright awesome. And Star Jones, Sora Star, Star Jones, you are amazing. You have done an outstanding job moderating this panel. And we give you a virtual round of applause. Thank you so much. And now, back to you, Star.
Dr. Glover, don't try to take my job there. You are fantastic here as the co-host here. Sora, I have to tell you, like Yamiche, I pledged a sorority as an undergraduate, and as you know, I served on the national board. I was trained by everyone who was an Alpha Kappa Alpha woman, and so every part of who I am comes from some way a foundation that was built with Alpha Kappa Alpha. So I am grateful for the opportunity to share with our Soras across the world. Thank you all so very much, Madam Supreme, for this opportunity. To our power presenters, as we wrap up this evening, I just want to thank them again, who they all did an amazing job. Dr. Patrice Harris, Senator Kamala Harris, our journalist soror, Yamiche Alcindor, the brilliant Bishop Leah Daughtry, and of course, our very own Dr. Glenda Glover. Thank you, ladies, for everything that you did tonight. And on behalf of the leadership of Alpha Kappa Alpha Sorority Incorporated, I'd like to thank you for joining us. I wish you a great evening. May you, your family, and your loved ones continue to have health and hope. As I always say, she who has her health has hope, and she who has hope has everything she needs. Thank you so very much, and have a wonderful evening.